Medicare Advantage plans, or Part C. Part C of Medicare is also referred to as Medicare Advantage, and the plans that you elect to fulfill this role are called Medicare Advantage plans, MAPDs, or MA-only plans. These plans can get pretty complicated because there are many different types. For this video, I am going to break down the three most common plans and their pros and cons. Remember that the primary benefit to a Medicare Advantage plan is a lower cost option to having a maximum out-of-pocket on your Medicare coverage. That means you have a stop loss to stop the bleeding if you enter a catastrophic medical scenario. This is perhaps the most common type of plan. PPO means Preferred Provider Organization. With these plans, you have the reduced cost sharing when you are using a preferred provider or a member of the PPO network. You are not, however, required to use a PPO provider to receive medical services. PPO plans typically have extra benefits like dental, vision, hearing, etc. PPO plans normally include drug coverage. HMO is probably the second most common Medicare Advantage plan type. As I am saying this, I am thinking nationally HMO plans could be the most common, but we most commonly use PPOs. HMO means Health Maintenance Organization. With these plans, you have an assigned primary care provider, and they have to refer you to doctors, hospitals, labs, and specialists within the network in order to receive benefits. You may be saying, why would I limit myself to an HMO when a PPO is available? Well, here's why. If you normally use a pretty tight group of doctors and hospitals anyway, they're in the HMO network and you don't travel a ton, you can get an HMO plan and you typically have much lower copays, deductibles, co-insurances, and other cost-sharing parameters, as well as the ever-coveted extra benefits like dental, vision, hearing, rides to doctors, chiropractic visits, and over-the-counter benefits. Yes, PPO plans often offer some of these benefits as well, but HMOs expand the benefits with money that would normally be used for larger networks. HMOs also normally include drug coverage with them. I wanted to add MSA plans because they are often extremely valuable for certain types of people. This type of person is normally very healthy, financially stable, not rich necessarily, and has a positive outlook on the future. MSA stands for Medicare Savings Account. These plans are high deductible health plans with an annual deposit that can build up an account value that will eventually eclipse the deductible and provide someone with 100% coverage. They have the added benefit of normally being a zero premium, accepted at all providers that accept traditional Medicare, and the growing account value can be used for any IRS qualified healthcare expenses, including dental, vision, hearing, etc. The cons of these would be that if you have health problems that arise too quickly, you can spend more than is on the account and the deductible would cause you to have a substantial out-of-pocket amount. Another con is you still have to buy a standalone Part D plan, but your MSA account value can be used towards drug copays. Sometimes we recommend a hospital indemnity plan with riders that are designed to fill the holes in Medicare Advantage plans. These plans are often extremely valuable. One of the things we commonly recommend is an MSA plan with a hospital indemnity with a lump sum cancer rider until the account value of the MSA plan has reached a level that wouldn't require you to have that hospital indemnity plan in place anymore, and then you can shed it. This is like a vanishing premium. Dental, vision, and hearing. When someone chooses a Medigap plan, they normally don't have non-medical dental, vision, and hearing coverage. When they ask about these benefits, we recommend a couple of different plans depending on their needs. Mostly Nationwide and Manhattan Life fulfill these needs the best. Most of the time, these plans have 1-year waiting periods on major services, so we consider them long-term solutions. We don't sell them as a quick fix to a big problem. They're a long-term fix to your dental, vision, and hearing needs. Another thing with these benefits to consider is that with Medicare Advantage, you often have some of these included, but it may not be a bad idea to have one of these plans to give you a boost in coverage. We always recommend a lump sum cancer plan for our clients. Here are the two situations it's needed. One, if you have Medicare Advantage plans, you typically have to pay 20% of your outpatient chemotherapy or radiation until you have met your maximum out-of-pocket, which is normally between $4,000 and $10,000. So a $10,000 lump sum cancer plan can cover that for 1 calendar year for a Medicare beneficiary. 2. Medicare's drug coverage can leave major holes for a lot of high-priced cancer medication, which is more and more often being used instead of outpatient radiation. These medications can cost someone $10,000 to $15,000 a year. At a minimum, we recommend a $10,000 lump sum cancer policy for our clients, but a bigger one up to say $50,000 would not be a bad idea at all.